This podcast is really important for everybody to listen to. It's about PMDD, premenstrual dysphoric disorder. I have Jenny with me who has PMDD, and she has struggled for far too many years. She's not been believed, she's not been listened to, she's been given antidepressants, she had a hysterectomy. No one thought about hormones. She's done this amazing picture that we talked through, showing the contrast between the good days and the bad days of having PMDD. It's a really common condition. It's a more severe form of premenstrual syndrome, but premenstrual syndrome is still not understood enough. It's not talked about enough, and it's certainly not treated well enough with the right hormones. So listen to this, share this episode with as many people as you know, because it could not just change lives, but save lives too. Jenny, you are here.
I am.
In real life. You've come down from Stockport. You've got your mother for moral support.
Yeah.
It's a big thing that you're here.
Yeah.
And I'm really excited to be talking about PMDD.
Yeah.
Which most people don't know what it is, although it's been around forever. It's been called different things. So premenstrual dysphoric disorder.
Yeah.
It's a more severe form of PMS, premenstrual syndrome. There's lots of academics will argue and discuss how to diagnose it. But for most women, it just means they're having a really difficult time throughout their menstrual cycle, usually before their periods. And you have had a really difficult time, and you're here to talk about it because you are feeling better and you're getting better all the time, which is wonderful. So do you mind, it's not easy, I know, but do you mind just talking a bit about what's happened?
Yeah. So I went to my GP for years and years, and with depression symptoms, and they kept giving me, I think I tried every antidepressant that there was, and none of them really did anything. But I kept saying it feels like it's in relation to my cycle. But they were like, no, because my periods were regular. They were like, no, it can't be anything to do with your hormones. So this went on for years and years.
So when did that start?
I'd say around 2006-ish.
So how old were you then?
I was in my 20s.
So when your period started, were they...
Looking back, I think I could have had it since I was a teenager. And then I was seeing a regular counsellor through a charity that's near our house. After my son was born, a sleep week. This charity was really good. And because I was seeing her once a week, she picked up on the cycle. She picked up on it. And I have chronic fatigue syndrome, so I was seeing an ME nurse as well. And she also picked up on it, and she was the one that printed the document out and said, please go take that to your GP. I think that's when it was PMDD. And when I read it, I couldn't believe it.
Because it all made sense.
Yeah, it was me. It was just... So I took that to the GP, and they agreed to refer me to a gynaecologist at that point.
And what symptoms were you getting?
It was more the mood symptoms that I struggled with the most. The worst one was the feeling like not wanting to be here anymore, which it started where it was about maybe 1 week of the month, but as it got more towards the end, I was feeling like that 3 weeks of the month.
So 3 weeks of a month you were feeling like you didn't want to be there?
Yeah, and then it would hit, and then I'd feel okay, and then it would hit me again, and it was just a constant cycle and it was feelings like not feeling good enough, and a lot of mine I would say were mental, but also another one of the symptoms is binge eating, which I was struggling with, which actually turned into an eating disorder, I think, because my PMDD was left so long.
Yes.
So then that was like another thing to battle.
That's really hard. And we know with the hormonal changes, our hormones work in every cell of our body, so they affect our brains. So the mood, the irritability, some people get very angry as well.
Yeah.
But then also it can affect our metabolism, and people can get changes in their insulin and glucose as well.
Yeah.
And a lot of people listening will, I'm sure, have had times where they have sugar cravings those days before your periods, but all you want to do is think about food. And, you know, I've had it, we've all had it, but then suddenly realise, oh, well, yes, my period's come and I don't feel like the same with food. But if it's more extreme, for some people, like you say, it can really affect the way that you eat, can't it?
Mine got to a point where it wasn't that, it was, someone explained it as like a form of self-harm. So, and it wasn't that I didn't want to eat healthy. It was my head was telling me I wasn't good enough to eat an orange or to eat fruit or salad.
Yeah.
It was, no, you need to eat food that's going to hurt. I wasn't good enough.
Yes.
So it wasn't just that I ate a lot, or there was a lot more.
More than that.
Yeah.
And that's really important to talk about, actually, because we know that a lot of women with PMDD, and PMDD affects, we don't know amongst a lot of people aren't diagnosed, but it are at least 5%, which is a lot, 1 in 20 women, probably more. And some studies have shown around 80% of people with PMDD self-harm.
Yeah.
And you can self-harm in different ways, as you've just described with eating. And for some people, they can physically harm themselves as well, can't they?
Yeah. Yeah, I've heard of people that do. I think my head was doing it in a way that people couldn't see.
Yeah.
Apart from the weight, it wasn't something that there was no physical marks or...
No.
People, I think my head was trying to hide what was going on in front of other people.
And then did you have any other symptoms that didn't affect your mental health? So any palpitations?
Looking back now, there were things that the doctors looked into, which looking back now was probably the PMDD.
Yeah.
Like the heart pounding, even like the chest, like anxiety.
Yes.
Like flutters. And aches and pains as well.
Yeah.
I've been diagnosed with fibromyalgia, but...
How much is related? Yeah.
The more you learn about PMDD, it affects so much part of your body.
And did you get any skin changes, any skin dryness or itchiness or anything?
I do get itchiness and dryness, but I have muscle activation as well, and my hormones affected that.
It's the whole balance of hormones that's so important. And many people will know the graph that we're often taught at school, where people get a little surge of hormones when we ovulate in the middle of our cycle. Then we get a surge in the second half. It's called the luteal phase, where we get higher amounts of estradiol, but also very high levels of progesterone that then fall very quickly. And that fall very quickly can trigger symptoms for a lot of people. And often people have underplayed, really, the power of hormones.
Yeah.
And when years ago, you might know, in the 1960s, a doctor called Katrina Dalton coined the term premenstrual syndrome. And she wrote about it, and she talked a lot about PMDD, premenstrual dysphoric disorder. And she gave a lot of women natural hormones, especially progesterone. She lectured on it. Lots of people came to her clinic. Really, she transformed a lot of people's lives. But a lot of people didn't like the way she was lecturing. They thought she didn't know much. She was only in inverted commas, a GP. And the antidepressants were coming into play. And the psychiatrists decided to label it a psychiatric disorder. And Prozac, the antidepressant Prozac was green. And they made one that was pink and purple, specifically for PMDD.
It's
awful, isn't it?
That's frightening.
It's really frightening. And so then it became a psychiatric disorder. Now, it's very likely related to changing hormones. Our hormones work everywhere. And one of the things, as you know, in the clinic, we ask people lots and lots of symptoms, and we've increased it. And it's the same as the symptom questionnaire on balance. And a lot of those are other symptoms. So like you say, the palpitations, skin changes, urinary symptoms and so forth.
Oh, that was a big one for me. Sorry, actually, I forgot.
Yeah. And so if people have all these other symptoms, it's very hard for me as a doctor to say it's all depression or it's all a psychiatric condition.
Yeah.
Because if it's all in your brain, your heart and your bladder and your muscles shouldn't really be affected.
No.
But sometimes in medicine, doctors don't ask the right questions, so then you don't get the right answers.
They just concentrate on one thing rather than looking at the bigger picture, and that's one thing I've learned.
Yes.
You need to have open eyes and look at the bigger picture.
Yeah.
I know professionals struggle with time and things, but it makes such a difference.
Absolutely. So you've seen lots of different healthcare professionals, haven't you?
Yeah, lots.
And you've not always got the best advice from them either, have you?
No. So when I got referred to the gynaecologist, she did some ultrasound scans. She was brilliant at the beginning. And then they put me on the waiting list. They decided I was having a hysterectomy.
To remove your ovaries as well?
Yeah. So they actually gave me, was it Prostap?
Yeah. So that's to block it's a hormone
like
blocker,
chemical
isn't
menopause.
it?
Yeah. So they gave me that, but after 2 injections or 2 months, it affected my blood pressure.
Right.
So they took me off it.
What, your blood pressure went up?
It went really high, yeah.
Yeah, that's because, I'm sure you know, you don't have your natural hormones, which help reduce and lower your blood pressure.
So it was through the roof, like dangerously high. So they took me off it. I did, in the short time I was on it, I did see improvements. And because of that, they said, we'll put you on the waiting list for a hysterectomy. That's the best option for you. So I went onto the waiting list. COVID was a factor in it as well. But I was on the waiting list 2 years. And in that time, I was coping with the PMDD. I was waiting to see an eating disorder specialist who told me I wasn't allowed to be on any diets until I'd had the treatment. And this consultant was telling me to lose weight for my surgery.
Right.
I was like stuck in between two professionals. And this went on for 2 years. And after this 2 years, I got took off the waiting list because of my BMI. And this doctor knew that I can use this word now. I've never been able to use it until recently. I told this doctor that I was suicidal for 3 weeks of the month. And there was no compassion. She just kept going on about my weight. And then when I questioned this, I was told that they're trained in gynecology, not mental health, so they don't know what to do with what I told them about feeling suicidal. And that's one thing that made me want to do my awareness, because I'm lucky I've got really good family and friends to support me, but not everybody has.
Not everyone does.
And that could have really tipped somebody over the edge. So it's just looking at the bigger picture again.
So how did you manage to find somebody to help you with your hormones?
At this point, I went to see a private gynecologist, which was hard because I was already struggling because I'd not been able to work.
Yeah, of course.
I think I'd not worked for about 4 years up to this point. And this gynecologist, he put me on Zoladex.
Another hormone blocker.
Another hormone, which does the same as the Prostap.
Yes.
So he put me on that, and my blood pressure was okay, so they kept me on that. And he was a lot talking about my mental health as well, until I went back 2 months later, and he looked PMDD up, and he apologised because he said he genuinely didn't know the effects of it. And that was, him apologising was actually quite nice, because it made me...
It validates you more, doesn't it?
And that's what made me want to do my awareness as well. Because he was a gynecologist and he didn't know about it, and it just gave me a bit of a light bulb moment. I thought, if gynecologists don't understand it, we're not going to get the right treatments, are we? Because that's who you get referred to. So he gave me the Zoladex for a while, and then because he knew like I was struggling with money wise, and he helped me as much as he could because he knew how I'd been treated. He transferred me back to the NHS to another consultant. And he couldn't have referred me to a better... He was lovely, the consultant. Great. Yeah, he was lovely. And the day of my surgery was the calmest day. Nice. I didn't know you then. But since I've learned things from you, hysterectomy maybe there might have been other options to not have gone down that such serious route. Yes. There could have been other options they could have tried with HRT and other hormones, couldn't they? I think, from what I've learned from you. Yes, but you don't know what you don't know. That's the problem. And now you are taking some hormones, aren't you? Some natural hormones. Well, even after my hysterectomy, I was told after 6 weeks you go on HRT. So 6 weeks came, and the first 6 weeks I actually felt incredible. But then about week 7, everything changed. And I thought the PMDD was coming back, which confused me because I thought, how can it come back? Everything's gone. And then I contacted my GP, and they were like, we'll just wait for the hospital. Anyway, it got to about 3 months and I still hadn't been given any HRT. And then they finally gave me a patch, which wasn't doing anything at all. And it wasn't until I found you. And you've helped me with different hormones.
Before we continue, I'd like to tell you about Newson Clinic, the sponsor of this podcast. I founded Newson Clinic to improve access to expert, evidence-based hormone health for women. Our specialist clinicians support women with perimenopause, menopause, PMS, PMDD, postnatal depression, endometriosis, PCOS or PMOS, and other hormone-related condition. My clinic makes this podcast possible, allowing us to continue sharing free education and information to help women better understand their hormones and health. To learn more about Newson Clinic or book an appointment, visit newsonhealth.co.uk. This link is also in the show notes. It's really interesting and important actually that people realise this, because I see it a lot with any hormonal imbalance, but especially with PMDD, because people in some ways rightly think the hormones are to blame. Let's just remove the ovaries and then we won't have hormones.
Yeah.
Now, there's a couple of problems with that. One is that our hormones are made in other organs, not just our ovaries. They're made in our adrenal glands. They're made in our brain.
Yeah.
You can't take out your adrenal glands. You can't take out your brain. So it will help some of the imbalance, but not all. But the other thing is, a lot of people have the symptoms because of the change in hormone levels. And our hormones are really, really beneficial for us as well. They have lots of beneficial effects. And you're young as well. You know, you want hormones for your bones and your heart and future health. And so it's a very sort of wrongly too simplistic thing to remove the hormones. And I remember years ago, it must have been about 8 or 9 years ago, a 74-year-old lady came to see me in the clinic. And she had more sort of PMS, maybe PMDD. I mean, the symptoms are similar. It's just the severity, really.
Yeah.
But she'd had a hysterectomy when she was in her 40s. But she said, every month I still get symptoms. She said, the beginning of the month, I get a drop in the mood, I get anxiety, I get palpitations. And I remember listening to her and thinking, well, she's had her ovaries removed. Why is that? But I've always been taught to listen and believe your patients. So I thought, I've got to understand more. And then I realised, well, of course, her brain has got this cyclical hormonal changes going on.
Yeah.
So, of course, it's right. And I gave her hormones because I said, well, I'm not sure about these changes, but I'll give you hormones for your bones and your future health and might help your symptoms.
Yeah.
And she came back a few months later and she said, I feel amazing. I wish I'd done this years ago.
Yeah.
So then I thought, well, we shouldn't just be blocking hormones. We shouldn't just be giving these hormone blockers or removing ovaries without talking about having those hormones back.
Yeah.
And a lot of women with PMDD, once you get the level of hormones and the same all the time, because that's the big difference. It's the change, isn't it? Yeah. And for you, there were more downs and ups. Yeah. Some people it's just a few days, but for you it was the majority of the month.
Because it did get longer as time, so I don't know if it's because it had been going on so long. Maybe
often can be, can't it? Yeah. And it's really hard sometimes in medicine when we have a patient in front of us. We focus on what's happening on that day. Yeah. If you see what I mean. Yeah. And one of the things I've really learnt when I'm trying to work out whether it's hormones or not is just ask the patient, do you feel the same every day of your cycle? Yeah. And if someone had asked you that many years ago, once you'd worked it out yourself, it was very clear that you didn't feel the same every day of your cycle. Yeah. And that's what I think all doctors and nurses and pharmacists and healthcare professionals should be asking anybody with any mental health symptoms, because so often people are focusing on just today's symptoms and not putting it into context, and then they're forgetting about hormones.
Yeah. I think it goes down to being listened to again.
Absolutely.
I don't feel like I was listened to.
No.
At all. And then when they decided on the hysterectomy, I was made to think I'd have the hysterectomy and life would be rosy. And it isn't. That's not the... and I think if I'd not met you, I'd still be struggling with the patch. That wasn't... Like when you did the blood test along with my symptoms, and you said I'd not had any hormones for, I think it was 18 months to 2 years.
And how old were you when you had your hysterectomy?
It was 2 years ago, so 41.
So young.
Yeah. And even maybe this might help someone else. When you put me on progesterone, I was a bit wary at first because when I was put on the pill, which they put me on to try and help, it made me so much worse. And I was made to think I had a problem with progesterone.
Yes.
So when you suggested it, I was
Really nervous,
willing
weren't
to.
you?
I was
Yeah.
nervous, and I honestly cannot believe
Yes.
I had 2 weeks where I couldn't take it because there was a problem with my prescription, and I could tell.
Yeah.
It's made such a massive difference. So if other ladies are worried about taking it,
It's really
worth a try.
important, and thank you for saying that, because what happens is a lot of people call the synthetic progestogens progesterone,
Yeah.
because it used to be called the progesterone-only pill, whereas
Oh, yeah.
progesterone is the hormone that we make ourselves.
Yeah.
And obviously you're taking now on prescription, but it's a very different substance to the synthetic progestogens. And so a lot of people, especially with PMDD, have quite severe side effects with progestogens. Either they've had them as contraception, or they might have had like the mini pill or the implant or a
Yeah.
depot, or use a synthetic hormonal coil. So then they get quite scared.
Yeah.
And then a lot of people think, well, if you've had a hysterectomy, you don't need progesterone.
Yeah, I was told I only needed estrogen. I
Yeah.
didn't need testosterone or progesterone.
Yeah, which is crazy, really, because our hormones, progesterone and testosterone, as well as estradiol, are made
Yeah.
in the ovaries.
Yeah.
So to have your ovaries removed, your hormones, although they're made elsewhere, would have been lowered.
Yeah.
And so having the natural progesterone at the right dose can
Yeah.
make a real difference.
Yeah.
And what's very frustrating for me, as you know, I spend a lot of my time frustrated, is that even in the 1960s, it was known that progesterone, the natural progesterone, is a really beneficial treatment for PMDD.
Yeah.
Yet it's not given
Not
first
given.
line.
No. So yeah, that if that was prescribed, that could have avoided like major surgery
Yes.
and years of trauma.
Yes.
Because
Yeah.
it was having this surgery as well, being on the waiting list, that caused so much trauma.
Of course, yeah, yeah. And that's a lot for a lot of women, you know. Even the guidelines, as you know, for PMDD don't mention natural hormones.
No, they don't. No.
It's crazy, isn't it?
Yeah, it's just the chemical menopause and hysterectomy that's
Or antidepressants.
Or antidepressants,
Yeah. So were
but-
you given antidepressants?
throughout the years. I think I've tried every antidepressant going, and none of them.
No.
I'd say none of them. Some of them maybe took the edge off, but
Didn't make anything
didn't make
dramatic,
any. No, not at all.
So it's very hard also for family members, isn't it? It's
Yeah.
not just for the individual who's got
No,
PMDD.
Because in my story that I've done for my awareness, I've put in there, I feel like it robbed my children of their mum, my husband of his wife, and my parents of their daughter, and it's cost me a lot of my life, really. It's robbed me of my time with my children, and
Yeah.
as much as we've done things in our own way, but it has robbed a big
Yeah.
part of their life, really, their mum in their life.
Yeah. And you're doing a lot of awareness.
I'm trying.
So you've done this picture,
Yeah.
which is just brilliant. And I've shown it in loads of presentations, and it's called Hormone Health. And there's a picture of a womb, and it's two sides, isn't it?
Yeah.
So I'm just going to read some of the words. I mean, it's the bigger part says suicidal thoughts
Yeah.
on one side. And then you've got paranoid, weight gain, depression, cramps, fatigue, bloating, migraine, anxiety. It goes on this side. And then you've got a rainbow and living life to the full, which is what we should all be doing. I mean, life is not good every day for
No.
everybody. That's just not life. But you've got smile, enjoy, relax, social, function, self-care, energy, calm, kind. These are all really, really important words. And it's a real black and white, isn't it?
Yeah.
It's like night and day, which is what so many people say to me, the difference.
Yeah, the difference, yeah, it is.
So if you had a mental health condition, this would be there all the time.
Yeah.
But you've got to have glimmers of this.
Yeah. I think that's what makes it harder as well, having the glimmers and then being hit by a brick wall.
Yes, yeah. And I
Just
know,
constant.
having spoken to many people with PMDD, even when you're the rainbow side,
Yeah.
you've got the other side hanging over you because you know it's going to
You know
come.
it's coming, yeah.
So, which is
Yeah,
really
you're
difficult,
just
isn't
waiting.
it? It is.
It's like a wait. You're waiting for the
Yeah.
wave to
Yeah.
come and knock you over.
Yeah. So I spoke to someone at the weekend. I did a consultation, and she's had PMDD, and she's in her mid-20s, and she couldn't sit her exams, her A-levels, because they came just before her periods.
Yeah.
So then she couldn't get into university that she wanted to. She couldn't get the job she wanted to. She's under a gynecologist who said, well, I think they have a hysterectomy. She hasn't had children. She doesn't know whether she wants them. And they said, we could give you 2 coils together, Mirena coils, and put 2 in together, and that might help some of your bleeding. And she doesn't like the synthetic progestogens.
No.
So she said she didn't want that. And they said, well, they're your options. So I worry about younger people because they're not reaching their potential.
Yeah.
You know, you've been really lovely and great and honest about the impact it's had on your personal and family life. But the only way I think we can change is awareness and choice. And I'm not here saying we can't have these other treatments, but we have to think about the basics and hormones as well, and the balance of those hormones.
Yeah.
You know, you've had difficult time, but you are improving, which is wonderful.
Yeah. I'm not to the point of living life to the full.
No.
But I'm on my way.
But you're on your way, and you've come
and
down here.
I can see the road ahead now.
Which you couldn't
before. I didn't even want to wake up in the morning.
No.
And now I can see the lights on its way.
Yeah.
Well, that wouldn't have been possible without you.
Yeah.
Because if you'd not done the HRT, I'd still be struggling.
Yeah. And you've come a 2-hour train journey into London. It's a massive thing. I can't even overestimate how much it's been for you to come here.
Yeah, it's been a big deal for me.
And you've done so well, but it's so important because, you know, you can learn from me as a doctor, but actually I learn so much from patients.
Yeah.
And other people need to learn from real life scenarios because it will resonate. And I know your story will resonate with a lot of people.
I think because it's so real as well.
Yeah. It's so real, but also you're getting better.
Yeah.
Because you've got the right balance of hormones
and
the motivation and now the knowledge and the reassurance as well.
Yeah. I think having the right HRT as well, I can function a bit better. So I can function a bit better if I can help myself a bit more.
Absolutely. They all go together.
I couldn't function at all.
So it's so important. We're doing a lot of work about PMDD through Balance app as well.
Yeah.
Because the more people that have that knowledge to share, the better. Your work is so important too.
Yeah.
So before we end, I always ask for 3 take-home tips.
Yeah.
So there might be people listening today who've either think, oh my goodness, I've got PMS or PMDD. It actually doesn't matter in the respect that the treatment is still with hormones.
Yeah.
So they might have PMDD, or they might think, goodness me, that's my daughter, that's my niece, that's a colleague at work.
Yeah.
So what 3 things, Jenny, do you think would be important for people to know when they're just learning about PMDD?
Firstly, to make sure you speak to someone.
Yeah.
Your family maybe first, and speak to them about how you're feeling, just so they're aware, and that might help them help you a little bit. But don't give up with professionals. Keep going. If you have to go to your GP, keep going. Don't let them make you I felt really dismissed.
Yeah.
Don't let them do that, because don't give up. And I was told I wasn't entitled to a second opinion, but since then I've learned you are entitled to a second opinion,
And a third and a fourth.
So don't let them say no and make you feel like giving up. Keep going. You'll find someone that will listen. It might take, hopefully by this podcast, it might not take as long, but you will find somebody that will listen. It might take a few professionals, but you will find someone.
Yeah. Really important.
Yeah.
Really important to advocate for yourself, to speak up, to listen, but to share.
Which is really hard when you're in that.
It's so difficult.
It really is.
Yeah.
But you need to be brave enough to, which is hard, but...
Yeah, absolutely.
Yeah.
So thank you so much. I'm so grateful that you've come today.
Thank
I
you.
know this podcast will help so many people.
Yeah.
So thank you so much,
Thank you
Jenny.
for asking me.
Thank you. So just a quick one. It would be really great if you could follow or subscribe to this podcast. This will really help me reach more people with evidence-based information about hormones and their future health, and also means you never miss a future episode. Thank you.